Good afternoon, everyone, and welcome to this special lecture series here at the Family Research Council. Today, I am privileged to introduce a good friend of the Family Research Council, a friend of mine, and a champion for the things that we fight for and advocate for here at the Family Research Council. When it comes to the issue of life, of course, she doesn't stop there. Although she's been a champion on life, she's been a champion on religious liberty and freedom, family, all the other things that we care about. And I often talk about this on radio, but it's a good opportunity once again to remind our viewers out across the country that are tuning in for this lecture. We have many dedicated men and women serving on Capitol Hill in Congress who share our values, who advocate for them day in and day out. Now, when you look at the polling data of Congress, life is pretty challenging when your polling numbers are lower than a used car salesman. But there is what's called a paradox of distance. And when people look at Congress as a whole, they don't like it, and it's easy to be against an institution. And certainly Congress is one of those institutions it's easy to be against. But when you look at individual members of Congress, and you begin to see members who have re-elect ratings of 60, 65, 70, 80% re-elect numbers. Well, you understand they're taking care of business at home and they're reflecting the values of their constituents. And there are a number of men and women. Unfortunately, they're not quite in the majority, but they're a strong voice for the things that you and I care about. Committed men and women that are Christians, that are not afraid to advocate for the things that we believe to be true, that the founders of this nation believe to be true. And so this afternoon, we have a member of the House Select Committee panel that is investigating on infant lives, investigating the sale of baby body parts that was uncovered last summer through the undercover videos of the Planned Parenthood operation. Diane Black, prior to coming to Congress, she has a distinguished career in the medical field, serving as a nurse, has now continued to serve in the capacity of being in Congress. Her and her husband have been married for over 30 years. They have grown children. But she has been leading on a number of issues, and her medical experience has come in very handy as she has led to protect conscience for those in the medical profession. She has worked to improve health care by eliminating as much as possible of Obamacare to give patients the choice of proper health care and to get the government out of it. But right now she has been an active member of the select panel investigating the sale of baby body parts, and so she's coming today to give us an update on that and certainly entertain your questions. So please help me welcome Tennessee Congresswoman Diane Black.
Thank you so much, Tony, for the introduction. And I will say that when we take a look at ratings, nurses are number one most respected profession in the entire country. And then politicians are way down at the bottom. So I think I'm somewhere around 50%. I'm right there in the middle if you combine both of them. So, Tony, again, thank you, and thank David Christensen for all that you do here at FRC. Your tireless work to advance things that are so near and dear to us, like pro-life and pro-family principles. You've made a real difference along the way, and we just want to thank you for helping to communicate that to the public, helping us as elected officials also to make sure that we are expressing ourselves in the right way. So today, as Tony's already said, I want to share with you some of the important work that we're doing as the select panel, investigative panel on the infant lives. And to be sure that I leave also plenty of time, we will have questions. But before I do any of that, let me tell you why this is so deeply personal to me. As some of you may know, and it's already been said, I am a registered nurse, and it was this career, through those countless patient interactions and the many hours that I spent with patients in the ER, and through that has really formed my pro-life worldview during that time over the last 40 years. I've seen countless births, been there to celebrate with parents when those new little ones come into the world, and each one of them are special. And I've seen how science affirms what our faith has told us is true all along, and that is life begins in the womb and that the unborn person is worthy of our protection. I was a young nurse working in a hospital in Maryland when the Supreme Court issued that 1973 verdict, Roe versus Wade. And at that time, politics really was the last thing from my mind. But even then, I could not reconcile what the Supreme Court's decision was with what I knew and saw to be true. I had taken an oath to devote myself to the welfare of those that were committed to my care, and yet the action of abortion destroyed that innocent life. 25 years ago, when I first entered public service, I did so with the promise of continuing to honor that vow and to defend life. And that is one of the reasons that I feel so strongly about Planned Parenthood. Even before last summer's videos were exposing Planned Parenthood and their role in the trafficking of aborted baby body parts, their own annual report told us in black and white why we must expose them and go after what they stood for. They're the largest abortion provider in this nation. They perform more than 320,000 abortions annually, while they receive over $500 million of taxpayer dollars to perform those abortions. And that's why in 2011, just very shortly after I came here, my very first bill that I wrote, passed through the House as a member of Congress, would defund Planned Parenthood in a short-term funding bill. Unfortunately, it did not get signed into law. For many years, interest in defunding Planned Parenthood was really pretty tepid here on Capitol Hill. But last summer, we had an opportunity when the veil was broken, when David Daleiden and the Center for Medical Progress exposed the brutality of this organization through that series of undercover videos that Americans could see with their own eyes. I actually had people that watched the video and started to watch it and had to turn it off because it was so gruesome that they were unable to view the entire video. And yet, I encourage them, just try to get through it so that you can understand why I and others that want to protect life are so passionate about this issue. In the wake of these videos, which were authenticated by an independent forensic report, the House passed my legislation, the Defund Planned Parenthood Act of 2015, which would have cut off all federal funding for this abortion giant. Unfortunately, as we expected, it did not become law. However, this is the first time that a bill like this has ever gotten to the president's desk. And it is one of those issues where I say to people, if we had a willing partner in the White House, this is possible, so we cannot give up. So this really was, we wanted to, but as many of you have expected, the bill did not become law, so we wanted to focus, since this didn't become law, on the first steps that we can take to hold the abortion industry accountable that don't require the signature of a president. And that was the genesis, really, of the Select Committee on the Infant Panel Lives Select Committee. Okay, so let me talk about what we have been called. I know you all have read it in the media of what they have called us. They've called us a witch hunt against Planned Parenthood, though Planned Parenthood is never named anywhere in the resolution that authorizes the panel's formation, and was not called to testify at either one of our 2 public hearings that we have had to this point. What else are we called? We're called a circumvention of regular order, despite the fact that every member of Congress had an opportunity to vote on this matter. It was on the floor, and we even got 2 Democrats that joined us in support of this panel. What else are we called? We're called a deceptive, discredited video allegations, despite the fact that the videos were authenticated by an independent forensic analysis, not people that are pro-life, but totally independent. and that even the study commission by the Planned Parenthood found that there was, and I quote this because this came out of their mouth, no widespread evidence substantive video manipulation. Let me read that again. This is out of their own words. No widespread evidence of substantive video manipulation. And finally, we're also called an attack on women's health, which is pretty interesting since me and Marcia and Vicki Hartzler and Mia Love, who comprise half of the Republican membership on this committee. So now that we've established what our panel is not, I want you to hear directly from me of the important work that we are doing. While the panel's first public hearing was held March the 2nd, our work really began in earnest immediately after the panel was formed. We said at the outset of this hearing that our intent was not to create media frenzy, but rather to conduct a real, broad-based, fact-finding investigation. And that is what we are doing now. After a series of members' meetings, we held our first hearing on bioethics and fetal tissue, and we saw very clearly that ethics guidelines are not always followed among the abortion industry's partners. During our hearing, for example, we showed an email that was provided to the committee by a researcher at a leading university who had casually emailed a tissue procurement business asking them to send over, and I will tell you exact quote of what they asked for, a first trimester human embryo, preferably 8 to 10 weeks of gestation. This is not ethics, it's not dignity, and it is not respect for life. More recently, our panel had a hearing on the pricing of fetal tissue, and this is especially important because federal law already in existence, the NIH Revitalization Act of 1993, specifically prohibits profiting from the sale of fetal tissue. It's already in law. They are not able to profit from the sale of fetal tissue. But if you watch this hearing, it was clear even that the abortion clinics and the middlemen procurement businesses may have violated this law by the payments that they collected. In fact, even the Democrats' witness testified that StemExpress should be asked to turn over their banking records and documents to determine if they have profited from the sale of baby body parts. So since that time, the evidence against StemExpress has been even more overwhelming. There are new documents that we have received by our panel that StemExpress actually marked up the price for aborted baby body parts between 400 to 600% when selling their samples to researchers. We also learned that StemExpress's consent form does not meet the requirements for their forms stipulated by HHS. And for this reason, Chairman Blackburn sent a letter to HHS on June the 1st calling for an investigation. And if these violations are found, as we suspect they will be, we're prepared to take action on this as well. And by the way, we still have a subpoena out that requests StemExpress that are outstanding, and we will hold their CEO in contempt if the organization does not fully comply. Finally, our panel has also issued a subpoena to the infamous late-term abortionist LeRoy Carhart, who I believe is just another Kermit Gosnell by another name. His clinic is one of the few in the nation that performs abortions during the third trimester, despite the fact the overwhelming evidence of the health risks to the mothers and the fetal pain to the unborn. Public records indicate that at least 5 women have been sent to the hospital since December while seeking an abortion at their facility. Mr. Carhart has been asked to provide a deposition on June the 13th, and we've issued separate subpoenas to hospitals and first responders that may be able to offer some helpful insight as to the workings of the clinic. This is a total disrespect for human life, and should concern all people of conscience. An investigation is truly the least that we can do at this point. And as I've started, there is much information about the mission of our select panel, but I believe deeply in the work that we're doing. And I'm here today because I know that you do too. We've got big challenges this fall, but nothing could possibly be more important than how we treat an innocent human life. That is why we formed this select panel. It is why I'm serving as a member, and that is why we will fight back against every politically motivated maneuver to shut it down. As the panel continues, I'm confident that we can bring the truth out in the light of day, and we can hold responsible parties accountable, and we can deliver answers for the American people. I really thank you for having me here today, and now I will open up for questions. Who wants to have the first question? Yes, sir.
Thank you so much, Congresswoman.
I think they're going to bring you the microphone. If you could please identify yourself, that would be great.
Hi, I'm Jack Stuckel. I'm a congressional intern with my local congressman.
Oh, great.
Thank you so much for addressing us today. It's been a real privilege. I was just wondering, I've been involved in founding and running a pro-life society at my university. And I was just wondering, sort of a broader question, I'm sorry, but what do you think are the challenges for the next generation of pro-life activists and pro-life politicians,
Sure.
especially given all the anti-free speech movements at colleges, universities around the country? Thank you.
I honestly believe that your generation is the generation that could turn all this around. And let me tell you why I think that is. I am so encouraged by the number of young people who are standing up for life. Even though they may be socially liberal in some other areas, there is a new emphasis on human life with your generation. And here's why I believe that has occurred. If you go back to 1973, when I was a young nurse, we didn't do ultrasounds. Ultrasounds were not readily available. Ultrasounds were only done when someone had a potentially difficult delivery, or maybe there was a suspicion that there was anomaly with the baby. But we didn't do those until they were very late along in their pregnancy. And now we have ultrasounds that are 3D, where you can actually see a baby sucking their thumb. We see it's not a blob of tissue, as has been sold by folks like Planned Parenthood, to just say, oh, this is just a blob of tissue, which they're still representing in their clinics. They're not giving them the full information, but people are understanding that you don't get a heart, a brain, a liver from a blob of tissue. That is a baby. And so now the science has brought us forward to a point where we know life does begin at conception, and that we can see very early on that this truly is a baby. And I think with that, it's going to be a whole new revelation when people make those decisions. Now, I think also that, as you say, there's difficulty at universities. We see that across the spectrum with things that are happening in our universities, where many years ago, when I was a young person, you went to universities, they welcomed all kinds of discussion. You were allowed to discuss just about anything, because that was the place where everybody was to say, we have freedom of speech, and we were proud of freedom of speech. And now, if it doesn't meet the political rhetoric of that particular university, now you're not considered to have free speech anymore, because you're not saying what they want to say. And I think, again, this is where we have to stand up, especially parents who send their kids to universities that cost a lot of money, to think about, am I sending my young person to a place where they truly are going to be able to have open, free speech and develop their thought process? Or am I paying $60,000 for a university like Vanderbilt that closes it down, that says you can't have your free speech on our campus unless it's something that we want you to have free speech about, where they close down religious liberty on that university? $60,000 a year, I might as a parent think, Perhaps I don't want to pay $60,000 a year for my young person to go to that university where they're not going to have an open environment where they can really have true speech. So free speech. Well, I'm encouraged by your generation. I'm excited about your generation. I'm excited about the number of young people that I see in this room. And I really hope that you all continue to stand up for what you know is right and speak out, even when it is difficult to speak out. Another question.
Yes, ma'am. My name is Daniel Ashford, and I'm very pleased to hear all the things that you've been saying. But last fall, I was debating the college Democrats at the University of Alabama, and one of the things that they love to bring up is that Planned Parenthood does a lot of great things for women, and that abortions are a very small percentage. A lot of the research I've done shows that that's the largest thing that they do. They pretty much are an abortion provider. But what are the true statistics? Since you're in Congress, you've actually done credible research on what they actually do.
Well, the research that you have done is exactly the research that we are also seeing. We see that the numbers of abortions are increasing while the number of preventative services are decreasing. As a matter of fact, if you go back and look at Title X and when the money, where that money really is supposed to go according to the Title X, it was to go to help have healthy families. And to have those measures in those clinics that would be available if someone wanted to prevent a pregnancy. It was not set up to fund abortions. And yet that's the direction that has gone over the years, is more of that money has gone out to places like Planned Parenthood that are not really having as their goal healthy families, because if they were doing that, they would be looking more at their services of providing birth control measures, helping women who come to the clinic who are maybe have an unintended pregnancy to understand their choices, talking more about services for adoption, which is such a minor part of what they're doing now. So what that dollar was really was intended for at the beginning is not being used the way in which it was intended, which is why we continue to fight and try to support legislation that will move that funding away from the biggest abortion provider in the nation and move it back into those clinics where they are providing those kinds of services. And we're seeing states that are, because we're failing to do it at the federal level, they're doing it at the state level. My own state of Tennessee, while I was still back in the state of Tennessee, passed a law to say that our dollars would not go to Planned Parenthood facilities, but would go to the public health departments, the federally qualified health centers that are doing a very good job with complete care for women. They're giving them the comprehensive health care that we would hope that they would have. So that we have great choices with those clinics that are supported with public dollars and in comprehensive care without having the money, $500 million, $500 million a year going to a clinic that is providing many more services on that end than they are on the prevention end. So I encourage people when they say, oh, well, what will happen when you close that down? For every one Planned Parenthood facility, there are 17 other publicly funded facilities that are giving comprehensive women's health care. And that's where the dollar should be going. So it's a great question. Arm yourself with good information and be able to substantiate what it is that you're saying when you give that information out. So thank you for being a voice for us and a soldier. Others? Yes, sir.
Hi, my name is Micah. My dad is a medical doctor. He was an OB doc, helped delivered around 2,000 babies.
Oh, bless him.
My brother's a doctor. My grandmother was a doctor, and my uncle was a doctor. So, as
and
you
you're
can
not a
imagine-
doctor?
No, much to the chagrin, I'm going to become a lawyer, Lord willing. But what would you say is your advice to medical personnel who are interested in the topic or who have viewpoints on a pro-life stance? How are they supposed to get involved? Because it seems like it's all in the politics rather than in the medical side. What would your advice be to medical personnel to be able to get involved more?
Well, I love your question, and thank you for asking that question. And coming from the medical environment, I will tell you that I think that our doctors, our nurses, our practitioners in all the other areas that allied health that's surrounded should be helping women when they have an unintended pregnancy to truly understand what's going on in their body. And again, for too many years, it was just, well, it's a blob of tissue. But if they can help to educate young women with prevention first, using healthy practices to prevent pregnancies before they're ready for that family, that is number one. Let's prevent it first. But then when there is an unintended pregnancy, to sit down with that young woman and to talk with her about what her options are. And look, prior to Roe v. Wade, there were so many options for families that were unable to have children to be able to adopt a baby. And today, we see that folks have to go outside of this country to get a baby because we have so many adoptions that are killing our babies that there aren't those options around. And so helping young women understand there is another option besides abortion, that there are good options for that child to come into this world and reach their fullest potential by allowing them to be adopted. So just going beside those young women with helping them understand good prevention and comprehensive medical services, and then if there's an unintended pregnancy, walk with them, give them the options, help them understand there are other good options out there to bring that life in the world. Others? Yes.
Thank you so much for everything you've done, especially on this panel. I am wondering if you know of the next hearing for the select panel, and also I know that Carhart is supposed to show up on Monday for his deposition with the select panel. Mm-hmm. Do you have any word of whether or not he will?
I have not heard anything at this point in time, and no one's sent out anything to us as panel members to indicate that he is not coming. I sure would like to be there and listen to the deposition, and I was at the deposition that was taken, at least part of it, by a physician out of the University of New Mexico, who is an OBGYN doctor that is very active in the abortion industry in that university. And also the university uses those baby body parts for their research. And so I was there as part of that and was just stunned by her cavalier attitude of, this is not a baby. But I will tell you, one of the things that was so ironic for me is that the university has also asked her to be a part of their clinic would also do the abortions that were the miscarriages as well. And she talked about one of the rooms that they have that is a grieving room for when there is a woman who has had a miscarriage. And I wasn't allowed to say anything because the lawyers were the ones that were asking her the questions. But had I had that opportunity to ask her, I would have asked her, how is it that you can say that a woman who has a miscarriage, an unattended abortion, which when we do a medical record, if it is a miscarriage, it's also called an abortion. And that is very difficult when parents see that, but that is the medical term for the loss of a baby before its full maturation. And so how is it that you can say how important it is to have a room for mothers to grieve when they lose a child, and yet when they go into the abortion clinic, they're not offered that? Is it because you're not informing them this is a life? That you're just telling them that's a blob of tissue? Because if on one hand you think that it's important for a woman to grieve the loss of her child, why is it not important over here on this side when you do an abortion to make sure they have that same opportunity that you gave a mother who had a miscarriage? So I think that's really ironic that a doctor who is an OBGYN who has taken an oath to take care of their patients can say on one hand, oh, well, that woman doesn't need that kind of grief counseling, whereas this one over here does. And so I didn't have that opportunity, but if she does come before our infant panels, which I understand there is potentially an opportunity to have her as being one of our witnesses, that will absolutely be one of the questions that I ask her, because you can't divide that. It's impossible to divide. Others?
Hi, I'm Peter Sprigg with FRC, and I work on other issues, not this particular issue, so I just wanted to ask, you mentioned that the law already says that it's illegal to sell baby body parts for profit. My question is there an enforcement mechanism in that law, or are there penalties for violating the law currently? And if not, is that something that your panel would consider trying to institute?
Absolutely. It is a big piece of what we found as we were beginning to study this issue, to understand what the law actually provides or does not provide. And I remember early on, as we were reading all of the pieces that the committee staff were giving us to understand about tissue donation, that was one of our aha moments, because this Revitalization Act just kind of jumped out at us of how is it that they're selling, how can they take any money for these body parts when it's very clear in the law that you cannot sell body parts. Now, the interesting thing is if you go back and you look at the legislation that originally talked about tissue donation, all of that refers to a donation that would be given on an organ that would be used to transplant into another individual. Because nobody at that point in time when that was written, and that law, I can't remember exactly when it was written, but it was written many, many years ago, when I remember back in the time I was at the hospital and working in the emergency room, and we would have someone deceased in our emergency room, and we would ask them if they wanted to donate the tissue, and we would help them understand about how the tissue would be used. And you know, we can use many parts of the body for many different things. Some of it can actually be research, and that is in that part of the code. But it was never meant to be sold for what it's being used for now. And so it's very clear in there that you cannot sell that tissue. And so when we started digging into this deeper, and we saw specifically with StemExpress and how they actually have they had on their website, I understand it's been taken down now, but they had a list of the body parts and how much it would be to get one of those body parts. And of course, the body parts that are the more expensive are the ones that are more tender, like the brain tissue. That is very tender tissue, which is, by the way, not to be too graphic, but on one of the videos that was done by David DeLayden, it was a testimony or a statement that was made by one of the Planned Parenthood folks that in order to be able to preserve a brain tissue, they would have to take the entire skull. So that means decapitation. I won't go further than that, but that probably was the hardest video for me to listen to think about the dismemberment of this body. Going back to your original question, is it against the law? We believe the way in which they're doing this right now is highly against the law, and that is part of our investigation to be able to put all these pieces together to say, going back to look at this law that is quite old, and now the way in which that tissue is being used, how does that fit together? Because it was never intended for what it's being used for right now. I suspect that one of the things that will come out of our investigation is that laws do need to be updated, laws need to be clarified, and some laws actually need to be changed. I'll give you an example of one that I ran into when I started looking at the informed consent and what the abortionists will have on the informed consent for the mom. They don't really give them a choice about where the tissue will go. They'll say, we're going to either, the tissue will be discarded, or we're going to use it for research to find a cure for diabetes or Parkinson's, which, by the way, none of this has ever been used to find a cure, so it's a false narrative that they're giving them. But when I looked at the form that actually came out of California, and then I looked at the California law, there's actually a third choice in there that you could be given, and that is that you could have the tissue for burial, and yet that's not being offered. And so I believe that the dignity, and we're right now researching about every state and what they have in their state by state, but I believe the dignity of life should be that when someone is being given the information, that should be one of the alternatives that they should have, is that they have the right to that tissue. We in the hospital, when we had miscarriages, that absolutely was one of the options that we gave to the family, is that they could have the tissue for burial. But yet that's not one of the one of the options that's being given to the mother now. So that's a potential law that could even possibly be a federal law that would say all states must give that option to the mother.
Hi there, I'm here. And I'm from the Family Research Council also, and I just wanted to bring something to your attention, see if you know about it, and see what you think of it. The local Crisis Pregnancy Center in my county, which is Charles County, Maryland, is launching a new program to take volunteer moms into the schoolrooms with ultrasound equipment and allow the children to see a live ultrasound. And as I understand it, there are now so many crisis pregnancy centers around that do have ultrasound equipment and portable ultrasound equipment. Now, this could be, you mentioned that the youth have potential that in former generations they did not.
Yeah. And that is a debate across the entire country. Some of the states have actually placed in their state law that before an abortion is done, there must be an ultrasound. And it's not all the way across the entire country. But there are, thank goodness, there are so many good crisis pregnancy centers that are around. And crisis pregnancy centers now that are actually putting ultrasounds on mobile units and taking them out into rural areas. So I'm going to tell you a real fast story that is just will warm your heart. One of my counties had raised money for a portable unit and that could go out to the rural areas, because about 50% of my district is very rural, and we don't have crisis pregnancy centers in all of those counties. And so they finally did raise the money, and it was a mobile unit, and they have an ultrasound on it, and they were taking it out to the 5 surrounding counties, and great things coming out of it, a lot of really good stories. But here's the one I love the most. So they're back in town, and they asked the college there in this particular town, could they park the unit on the college campus? And they said, well, not really, but what we'll do is, if you will park it just right across the street from our campus, and it is a huge bus, then, and it's all wrapped, as you know they do these days, it's all wrapped, so it's very evident. The very first day they parked there, they thought, well, I wonder how many students we're going to get. Well, they got a lot of students, but here's the one that's really the most remarkable. This young girl walks over and she says, I'm pregnant, and I've already made an appointment to go tomorrow to have an abortion. But I thought, since I saw that you had a mobile unit here and an ultrasound, I would just at least get the ultrasound. Well, she did. And she was watching the ultrasound as they were performing it. She didn't have just one baby. She had 2. And I wasn't there, but the staff tells me that she just broke down and just wept out loud. And, of course, you know, they are wonderful about coming with them. And she finally wiped her tears, and she said, you know, I almost killed 1 child, but the thought that I would kill 2. She said, I'm going back to my dorm. I'm packing up my clothes. I'm going back home, and I'm going to tell my parents I'm going to have these babies. Now, I don't know that they know whether she kept them or she allowed them to be adopted. But either way, 2 lives were saved because of a crisis pregnancy center being there just at the right time. God was at work in that one. Yeah. I think maybe one more question, and then we're probably going to head on out. Anybody else have another question? Okay, well, seeing none, I want to say thank you for, again, allowing me to be here. Thank you for what you do for life, for what you do for families. Thank you for being willing to stand up. And I want to especially thank the younger folks in this room, because look, I'm an old lady and I'm only going to be around another maybe 100 years. Oh, well, my family says that sometime with the amount of energy I have. But leaving this to the younger generation and seeing the kind of commitment that you have, your ability to be able to articulate and help somebody else understand that this is truly a life and that this is important, is just making my heart feel so good. So again, thank you for having me here today. Thank you for what you do. God bless you.